And for me, that was the realization that made me start looking into what are potential solutions in the market. How is everyone doing it? And this is me with my years and years of corporate strategy and a strategic mindset kicking in and saying, how can we not plan for this?
Welcome. My name is Unity Stoakes, co-founder at Startup Health. Today, another health transformer conversation today with Aarabi from EmTech Care Labs. We're going to be talking about the caregiver moonshot, the Alzheimer's moonshot, and Aarabi's new solution called Care Wallet, which is in beta. We're going to be talking about really the great need, something that either already does impact all of us or will impact all of us, which is the need for better caregiver solutions for our families, for our parents, and our loved ones. So we will be talking about all the innovation going on in the world of caregiving solutions. Stick around for the conversation with EmTech Care Labs. Aarabi, how are you?
Good. It's the middle of the week. I finally managed to take some time off last week. So you're catching me much more refreshed, I would say.
You know, one of the things we always preach at Startup Health is how important it is for founders to rejuvenate,
Yeah.
to recalibrate, to take at least one day a week to really refresh. Otherwise, you burn out over the grueling journey that it is of building something extraordinary. So I'm glad to hear you did that for yourself.
Yeah, it was the first break of the year, but nonetheless a break. So I would take it. Yeah.
And where are you today?
I'm in Portland, Maine.
And I love that about, and we're going to talk about that because I know a lot of what you do is serve rural communities as well. And we'll talk about that. And I think being in Maine is an extraordinary vantage point for learning about the needs in different parts of the country. But why don't we start with learning a little bit more about you? I want to learn about you and your background and really what drove you to start EmTech Care Labs and the Care Wallet solution. But let's back up and learn a bit about you.
Oh gosh, where do I start? All the way back, maybe. I'm originally from India. I moved to the US right after I finished my undergrad, which was in engineering. So by training, and it's such a distant past now, by training, I have an electrical engineering degree, which I never really put to good use. I started my career at Lucent Technologies. This was right after Bell Labs or AT&T was spun off. So I was with Lucent Technologies for a couple of years, started as an engineer, but very quickly shifted on to product marketing and business development. So very early on in my career, I veered away from my engineering training.
I always thought that Lucent had one of the best logos of all time. And also a note on your engineering background, I think engineers can do anything. It's such an extraordinary background to have as a builder and as an entrepreneur. So that's really neat to hear about that.
It does definitely give you a more structured approach to thinking and how you solve problems. So from that perspective, it's one of those trainings that I've carried throughout my career and applied in various capacities, even though never as a formal engineer. Yeah. And definitely very helpful now as a founder as well.
So you were on the East Coast at that point?
Yes. So this is in New Jersey. That's where I started when I moved to the US. And then after that, I realized I needed to have a more rounded education around business, which is what prompted me to go get my MBA at Tuck, which is the business school at Dartmouth College in New Hampshire. Great to experience, also my first experience or exposure to rural living.
Yeah.
Yeah. So it was definitely a big transition going from having spent all my life in big cities to.
What city in India were you moving from?
Yeah, I grew up in Trivandrum, or what used to be called Trivandrum. Now it's pronounced Tiruvananthapuram, and it's the capital city of Kerala, which is one of the southernmost states in India.
What
And
was that transition like when you first came from India? What were some of the things that you noticed off the bat as being just totally different or totally new?
the first thing that really struck me was the vastness of space in the US. Having grown up in a city, you're just not used to seeing that much empty or open space. So everything from the highways to the suburbs to the commercial areas, it's just like such a big space. There's so much space in the US and everything is big, that much bigger. So that just stood out, the level of, or the infrastructure, I should say. It's just in your face. And again, this was in the 90s, so I'm pretty sure that has shifted quite a bit now. But at least back then when I first moved to the US, it was just jarring for me to realize how big everything was.
And then were most of your family still in India when you came here?
Yes.
Okay.
My parents are still in India. They live in another city called Chennai, which is a neighboring state compared to where I grew up. But they're part of the reason why I'm building what I'm building right now. But before I jump into that, I would just quickly summarize my professional background, especially after my MBA. I've spent almost 15 years of my post-MBA career doing corporate strategy and M&A. So really the management consulting track. First, I started as a generalist, then I started looking more at pharma, biotech, and healthcare, and then shifted in-house to do corporate strategy for the last company that I was working for. And it was really fascinating going from a purely advisory capacity for clients to taking on more ownership around executing on what I was advising or what I was recommending. And I found that transition from pure advisory to really getting my hands dirty in some sense in actually executing on innovation, executing on new ventures, and thinking about growing something from scratch. Although the reality of it, I would say, probably is much more drastic in the startup world, the life that I am leading now, where your hands are literally, or your fingers are literally in every possible aspect of the business.
You're doing everything. Yeah. What was that transition like from advisory to now you're responsible for execution? Was it a jarring transition or did you really enjoy it? What was that like?
I actually really welcomed it, in fact, because when you're really in an advisory capacity, you obviously get the big picture and you have a lot more comparable exercises that you've done with different clients that you can bring to bear in any situation. However, you stop at the recommendations and you walk away and you don't really see how it was executed. Was it truly meaningful, effective, and what was the outcome around it? So when I shifted from the sort of advisory consulting capacity to taking on more of my own responsibilities, even within the previous company, I would say there was a certain amount of pride that came with owning something. So I wouldn't say it was jarring as much as it felt good. It felt right.
Yeah.
Yeah.
That's good. And then, so walk us through the next phase of the career transition because now you are a founder, you're a startup founder, and you are fully executing. You're doing so many things as a founder. Walk us through that moment or what led you to that shift.
I would say I never really started out to become an entrepreneur. In a way, the purpose found me.
Hmm.
And part of that was because, as I mentioned in my previous role, which I really enjoyed, I realized I was making a difference at a much bigger scale. However, I was still consulting to corporations and working more with corporations or enterprises as opposed to consumers in some sense. So I was still a little bit removed from how my work and my thinking and my contributions are really moving the needle for from an everyday perspective. And a few years ago, as I mentioned, my parents live in India. A few years ago, we started noticing some decline, functional decline with my mom. And she started having more frequent falls. Again, no, we couldn't really figure out what was the problem, but the shift slowly prompted me to start looking into what is happening, how do we help her, and how do we really, especially remotely, help her navigate all of this, because it's me and my brother, just two of us, and both of us live in the US. Our parents were aging by themselves in India. And we started looking into what could be the potential set of problems. And that our slow research and discovery process. And I would say across multiple physician visits, many hospitals, many screenings, both in India and also here in the US, when we actually brought our parents here and we were consulting with some physicians here in Massachusetts, which is where we were at that time. And it turned out to be a very slow discovery. Over almost 4 to 5 years, we didn't know what was really the cause of the problem. It turns out finally it's Parkinson's. But what stood out for me in all of this is this long journey to discovering a diagnosis. In some sense, the diagnosis came as a relief, if I may use the word in this context. because at least now we know what it is that we're dealing with. Before, it could have been any number of issues, and just that experience alone prompted me to look into how do neurological conditions really affect our day-to-day living, particularly as a family, as someone who may be experiencing it, and family members who are seeing how a loved one is experiencing that, and that discovery path. And then the more I started looking into how are others navigating this, what is this discovery like for others, it just was this consistent discovery of everyone really figuring their way through this maze of discovery around whatever diagnosis it is, particularly the case with neurological conditions. And having been a consultant in the pharma space, I also knew that there weren't that many therapeutics that were in the pipeline that could really cure many of these conditions. Maybe temporary support and maybe slowing down, but no real cure. So that's what led me to the realization that this is just the beginning of the journey, just getting to the diagnosis. And then there is a long road ahead of how do you actually manage this and slow this down, or help your family members slow this down to the extent possible and get the timely help that you might need, either from the healthcare system or any community support that you can find to really manage this. And for me, that was the realization that made me start looking into what are potential solutions in the market. How is everyone doing it? And this is me with my years and years of corporate strategy and a strategic mindset kicking in and saying, how can we not plan for this?
And this is such a, I think more and more as our world's aging, this is becoming a universal issue that you're describing, where our parents, our mothers, our fathers, our families are aging, and many of us don't live near our families. We're all over the world. We're all over the country here in the US, and that's a very normal thing in today's world. So this issue that you're describing, it resonated deeply what you said, the purpose found you. And I'm sure there's a lot of people that will listen to this and they'll be thinking, wow, this is impact. This is sounds like my story too. So it's really interesting that you then went into a deep dive to start learning what solutions may exist. And what did you discover?
So first of all, the one thing that stood out is how fragmented the whole space was, because at least here in the US, and I think it's increasingly the case in many countries as well, the healthcare system is really specializing and further moving into specialties as opposed to looking at the person as a whole. And as such, all of the different ailments, illnesses, diagnoses, they're all treated in some sense as a siloed. Oh, they have this condition, so now you do XYZ to take care of that condition. If they have a new condition, then that just gets layered on top, but it's still treated as somewhat separate. So that's even within the healthcare system. And then there's the whole set of like, how do you really think about the person as a whole, not just their health, but also looking at their socioeconomic circumstances, their cultural circumstances, and how do families manage these kind of experiences in reality. And for me, what stood out across all of that is everything is fragmented. And within the healthcare system, there's a lot of structure, there's a lot of guidance. So for example, once you're in the hospital or once you are when you visit a physician, there's a lot more structure in terms of how your health is managed on the premises, so to speak. Once
There's
you go
like a
home,
whole system designed for that part of the journey.
once you go home, which is where majority of our life is spent, you are left to your own devices, either as a patient or as a family member who might be caring for the patient.
And your family might be spread out, even you and your brother in different places, and then your parents are in different places. Not only is the system fragmented, but our families are in different locations as well.
Yeah, exactly. And having experienced this through COVID, it actually opened my eyes even more, this fragmentation in the system, adding a whole level of complexity, especially when you're managing a lot of these remotely. Navigating during COVID, you're really relying on your network of your friends, this ripple effect, like really finding out like, hey, how do I make sure mom is able to get to her appointment during this lockdown? How do I make sure that she is getting the tests? Doing all of this remotely and relying on others, especially when you're far away, coordinating all of that is all in the details, because that's what it takes to make something happen. And that to me was one of those moments where I was like, I'm a very capable person. I consider myself fairly intelligent. I can figure this out. But it almost seems like all of us are trying to figure it out. Why do we have to keep rediscovering the same things when there could be a better roadmap, a better way to navigate this, that all of our cumulative experiences can be put to good use?
Let's talk about that because you're a key member of our caregiver moonshot community and also our Alzheimer's, dementia, brain health community that you're very active in. And let's transition to what you are building and what you're setting out to create with EmTech Care Labs. And if you want to describe your vision and where things are today and where you intend to go, I think that'll be helpful in framing where the opportunity here.
Yeah, absolutely. So as a company, our mission is to really empower families. And when we say families, it encompasses the caregivers and the patients to confidently manage complex care around neurodegenerative conditions. We particularly focus on neurological disorders, especially those that are cognitive in nature, primarily because we notice that is where the older adult or the patient is slowly losing their agency and hence relying very much on family or some other type of external provider to help them navigate all of that. And this is something that is extremely challenging for most families because there are complex family or complicated family dynamics at play. Everyone in the family has their own set of perspectives around it. And often they're in a reactive mode when it comes to discussing their options and figuring out how to navigate all of this. So what we have developed is a platform called Care Wallet. It is currently a web-based software. And it's HIPAA compliant. And the idea with this platform is we can provide virtual care planning and care counseling, meaning when we onboard somebody, we actually do a full assessment across the board to understand what is the unique nature of this patient or the person's needs in a home setting and really create a care plan that works for them in addition to what we're seeing from the clinical side, which is mostly their health and the medications and the treatment protocols that they need to follow. We also think about how do we help them with their functional needs at home? How do we think about their cognitive needs? Especially in the case of dementia, we look at behavioral changes that are happening with the person and layering on this additional detail around finances. And what we mean by that is often there is a very heavy reliance on support systems and resources in the healthcare system. So because when it comes to long-term care, navigating Medicare and Medicaid and finding supports that you're eligible for is complex in itself. And often families are not even aware of what's out there for them to support them in this journey. So when we think about care planning, we look at that as well to make sure that we're coming up with the recommendations that not only help them navigate the healthcare system in a timely way, but also tap into all of these additional benefits and resources that they're eligible for, either as a caregiver or as a patient in the mix.
So if I understand what you're building here, the platform at first, it's for the patient, it's for the families, and for the various caregivers and care team that are supporting the patient and family. And it also sounds like you're coming at this in a holistic way because there's aspects that might be related to the finances or the bill payment, as well as the clinical needs or the care plans. Is that correct? Or what are the focus areas of what the Care Wallet does?
So the first part of what you stated, Care Wallet is really designed for patients and the family caregivers. So this is really anchored around families and their needs. We have care managers who are also on the platform because the way we look at care planning is not just tech-enabled or AI-enabled care planning, but layered on top of that is individualized counseling that they're getting from an interdisciplinary team of care managers. And these are experienced care managers with background in nursing and occupational therapy and social work and dementia care, who can really bring more contextual guidance to the family that they're not getting today because the system is fairly fragmented when it comes to those navigating that. And we do this on an ongoing basis. So our care management is essentially in some sense, the care plan is adaptive in that we are looking at changing needs and making sure that the care plan that is being developed is one, comprehensive, and this goes to the holistic piece, and two, it is proactive in that it is able to point out the care priorities because it is a journey. Families or patients don't need to react to every scenario that's playing out. So we are really helping them, and this is through the care managers, helping them prioritize what are the immediate things that they need to do at this stage of the care that they need versus something that could be further down the road. And when we think about finances, we're not really looking at their finances in terms of bill payment. We are looking at what is the patient's financial situation that could potentially qualify them for Medicaid down the road, because obviously Medicaid covers a lot of the home and community-based long-term care services, whereas unfortunately Medicare does not. But even within the system, Medicare does address a lot of the additional needs that patients have. So we look at their financial setting to make sure that we connect them with resources appropriately. So in a way, it's a pre-qualification, if I can call it that. And beyond Medicare and Medicaid, states also have many initiatives around respite care, around safety at home. I'm talking about rural settings. One of the critical pieces here is distance. Access to care is a real challenge because, for example, I live in a very rural part of Maine. To get to the nearest hospital, it takes at least an hour. That is under the presumption that I'm actually able to get into my car and drive over there. And this is a reality for many rural folks, especially older folks. So we are looking at how do we tap into the right systems that may exist, support systems that might exist, and make sure that they're connected to those to ensure that they're able.
That for even things like groceries, or what level of connectivity do you intend to one day get to?
Yeah, so right now our focus is on healthcare. Healthcare meaning, are you able to make your doctor's appointments? So there are trade-offs that many older adults often make based on either distance, meaning I don't have transportation to go see my doctor, so I will delay seeing my doctor. Or my heating bill for this winter is going to be really high. I can either pay for heating or I can pay for my healthcare. Now, maybe on the surface, it may not have an immediate impact, but it is a choice that they're making. And it's a tough choice. And living in rural Maine, I can tell you, if I were in their shoes, heating is a priority. It's not an option.
Yeah.
So there is the sort of the social circumstances that are just as important, including, do they have an escort? Maybe they have transportation, maybe they do not have a medical escort to accompany them. So when we think about their barriers as to why they may not be taking timely actions, we are looking at, are there transportation mechanisms? Are there Medicare covered transportation mechanisms that we can connect them with to make sure that they don't miss those appointments? Are there state benefits around utilities that they can tap into to make sure that they don't have to make these really difficult choices around where they're spending their money?
Walk us through a little bit. The model is, will this be, or is it now direct to the patient and the families that can join this platform, or is it through other systems? Where is it today, and where do you see it going in the future?
Yeah. So right now we are in a pilot stage. So we are actually doing a research study around Care Wallet to really test out the care planning approach that I mentioned, which is fairly comprehensive, to see how this type of an approach, coupled with care counseling through experienced care managers, can really reduce family caregiver burden and patient self-efficacy. So that is an ongoing study where we are really, able to work directly with caregivers to see how this approach is playing out for them, and also helping us understand what are those maybe top issues, top of mind for caregivers, that we can actually start anchoring some use cases around.
And is that open? Can people still get into that pilot, or is it regional focus right now in Maine? Give us a little detail on who might be listening and helpful to support what you're doing and be a part of the solution here.
So this research study right now is for patients meaning, well, let me step back. The folks who we are enrolling are family caregivers. So we're not currently enrolling patients directly. However, these are family caregivers of patients who are either residents of Massachusetts or Maine. So those are the two states we are piloting, meaning the patient has to be a resident of one of these states. Caregiver, in theory, can reside anywhere. And we are particularly looking at Alzheimer's disease and related dementia. So it has to be some form of dementia, either formal diagnosis or suspected diagnosis. And we are particularly looking at early to moderate stages because we are focused on home-based care. We are looking at families that may have recently gotten a diagnosis. They don't know where to start. They don't know how this journey is going to play out. So we want to work with them where we can actually guide them through the various stages as their journey continues.
And we'll put a link in the show notes, but where would you like to send people to go to learn more? The EmTech website or some other location?
Yes, the best way to learn more about the study is obviously getting in touch with me directly. And I can also send out the study contact as well. So the research.
And we'll put links in the articles and podcasts so people can access that. I want to make it easy for people to get in touch with you because I think what you're doing is so important, and we need more innovators like you piloting things, learning, creating these solutions. There's such a need, in particular around this area of caregiving. So I just want to make it as easy as possible for people to support what you're doing. I think it's just really important.
We can also send you a separate link. I don't have it handy right now, but afterwards I can give you a separate link that focuses just on the study, if that would be helpful.
That'd be great. What's been the most surprising thing being now a founder yourself, a builder in this way? You're an engineer, you've lived in different places all over the world, you've been in academia, you've been in the corporate world, and now you're building with this purpose-driven kind of need here that you know so well. What's been most surprising to you? What have you loved about the journey? What have the biggest challenges been? And maybe some of your lessons learned. And there's so many people out there who sometimes the purpose finds them and they don't necessarily go do something about it, but you are doing something about it. I just want to learn a little bit more about what you've been learning along the way that surprised you or maybe even been challenging.
Yeah. I think I've been pleasantly surprised by how resilient I've been. I didn't expect. So when I first started this journey, this was about 4 years ago, as an idea, I was just playing around with it, see what I need to be learning, how do I navigate all of this. But very quickly, it crystallized in my head that this is something I have to do, that calling, that the sort of conviction, it found me. And when you're navigating something that is very unknown or uncharted for yourself, and you don't have a lot of other, while there are many founders who are exploring the space, we are all learning. There is no blueprint, there is no clear map that we need to be following. So it's a lot of trial and error and a lot of quick learning and a lot of reworking or pivoting as you go through that experience. And I've been very surprised at my own sort of agility to adapt to that way of living, coming from a very structured approach in corporate settings to just being this flexible and then being resilient. So that's something that surprised me, and I learned that about myself.
Like you're anti-fragile, where through you're getting stronger through the difficulties every day.
Yeah. And I do have to say, I am very blessed in that I've found very supportive communities, including my own family. And that's been my true north as I'm continuing to go on this journey. And that's also what makes it even more compelling for me to stay the course as I think about the future. The challenges, obviously, there are many challenges as a founder. I'm sure everyone has a laundry list in their head. But I think particularly in healthcare, it's really when you're addressing something that is fragmented at its core, it also means that you have to bring that many more stakeholders to the table to fix it. So this is not a simple solution that we are developing in an app that you download and then you can start using it and it solves your problems. It doesn't work that way. So this requires an ongoing commitment and engagement, not only from the family, but also the healthcare system, the physicians who are involved in the conversations, and the payers ultimately, because the whole idea of what we're doing in the long run is to help keep the patient healthy and with a certain quality of life in the home setting. Today, just in terms of pure stats, a dementia patient costs the payer system almost $240 billion, which is 3 times the cost of a non-dementia patient. And that is primarily because of repeated ER and hospitalizations. which over the course of time, we know that with the help of these virtual support systems, we will be able to reduce. And that conversation that needs to be happening across the different players in this ecosystem, and also policy. Policy has a huge role in all of this. So this is something that has a level of complexity that is, on one hand, exciting for me because it's a very stimulating challenge to solve for. But at the same time, it comes with its own set of frustrations and learning and figuring out how do you work with the system and what are the ways in which you can still bring change in a system that might be set in some ways.
You mentioned a magic word a few moments ago, that you've been blessed to be surrounded and part of supportive communities. You've been such a great member of the startup health community and these moonshot communities. Maybe it'd be helpful just to share a second or two. We've got just a couple minutes here on what that journey's like when you're not alone, but when you're with other people like yourself who are building, who have a purpose, who are trying to find solutions or create solutions. What's your journey been like, and how would you describe that?
I would say, at least from a founder community, it's definitely a very supportive community to begin with, because we are all building from something from scratch, something that didn't exist before in whatever current shape or form it is. And with that comes a level of humility, I think. And it also helps us to bond as founders, that sort of shared experiences that we have, struggling with things, figuring out a way, operating with very limited budgets, the challenges of fundraising, and how do you make your first sale? How do you convince your first customer or partner? All of those are, for most founders at least, are relatively new experiences, and we are all learning and sharing and commiserating in some sense. So I think that community is so important as a founder or a group of founders. But beyond that, it's also just learning from each other. So there's a wealth of expertise that reside across all of these different communities that I feel like if we tap into it the right way and share more of, the journey doesn't have to be as complicated and challenging as it often can be. And I personally appreciate that even more because I'm a solo founder, and taking a healthcare product to market, especially when the user of the product is not the buyer of the product, that's a very different ecosystem to work with, and the proof points that you need to provide, and especially as we think about scaling Care Wallet, there is so much that we need to track and measure and achieve in terms of milestones, which I think communities like these really help crystallize in some sense, the shared conversations we have, the challenges, and how do you navigate that.
Aarabi, thank you so much. The world needs more people like you who, are taking care of your parents, but also creating solutions based off of what you discovered a need to be, and sharing that with the world. We're so grateful to have you part of the Startup Health family and community, and so grateful that you're tackling this very big challenge. And I think it's going to make a big impact on a lot of people. So thank you so much for everything you're doing.
Definitely. I most certainly hope so, Unity. And thanks for this opportunity to share my story and also being part of this community.
Thank you.
Yeah.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.